Breast Cancer Awareness Month is coming to a close, but it's diagnosed year-round. And one plastic surgeon wants more women to know their options. In tonight's Ask the Doctor.
From mammograms and ultrasounds to breast self-exams, 13% of women discover they have breast cancer every year in the U.S.
I would say initially when people come in, they're feeling very overwhelmed. They got this diagnosis and everything moves really fast from there.
In many cases, women and their doctors have to decide fairly quickly their treatment options, from a lumpectomy to a mastectomy, chemo, radiation, and long-term medication. Add to all that what happens after the cancer is removed.
Most women are candidates for breast reconstruction unless they have advanced breast cancer or they are extremely overweight.
The team at Janiga MDs helps many patients through the process from start to finish. Oftentimes, plastic surgeon Dr. Timothy Janiga, who's been in practice 15 years, is even in the operating room when the cancer is removed.
So the breast gets removed, then you put the tissue expander in and it stretches the tissue to create a breast mound. So that's the first surgery. The second surgery, you take the expander out and put an implant in, and then the third surgery, you do a nipple reconstruction.
While not all patients are candidates for immediate reconstruction,
there are a small percentage of women who have advanced cancers who are going to need treatments, and in that situation, you'll often delay the reconstruction until after they complete those.
About 70 to 80% of women will start reconstruction right away. The process involving the tissue expander takes about a year to complete. Most women average 1 to 3 surgeries.
We'll get to see you from start to finish in your initial consultation and each one of your post-operative visits.
And they say while this journey can be overwhelming, you're not alone.
Their experience is valid. It's scary. It's an intimidating thing, but we can really say to them, if you can trust this process, we will walk you through this. And in the end, it really helps you feel whole again.
It's a very personal choice, but the staff at Janiga MDs says for many of their patients, it's a way to reclaim their bodies after cancer. And it's covered by health insurance as part of the Women's Health and Cancer Act of 1998.
And that's not just the involved breast, but it's also symmetry procedures, nipple reconstruction, tattooing, and prostheses after having a mastectomy.
And Dr. Janiga says the risk for breast cancer goes up with age. Diet and exercise, he says, plays a big role too. And men are also impacted. About 2,400 men are diagnosed with breast cancer every year in the U.S. If you have questions, we've posted a link to Janiga MDs on 2news.com. Bad odors continue coming from the Swan Lake area, where neighbors can learn how the smells could be impacting their property value.